Now for the next issue in the gastrointestinal tract, of course the gastrointestinal tract starts from the mouth to the anus. We'll be looking at the esophagus. So in the esophagus, we'll actually be pinpointing what esophageal obstruction. Esophageal obstruction. So esophageal obstruction, of course, it means that something is blocking the esophagus. Something is blocking it, right? So esophageal obstruction, it could be that something is swelling the esophagus and blocking it, or it could be that the layers of the esophagus are becoming thin, so they are also narrowing the passage inside the esophagus. So either one, so it's a blockage or narrowing, just like I was saying, right? So it actually makes swallowing difficult, so it can be caused by tumors. Tumors could be inside, growing and blocking it. Do you understand? It could go by strictures, where the esophagus like this, but something is tightening it outside. You understand? Sometimes it's foreign body aspiration, sometimes it's chronic inflammation, such as gastroesophageal reflux disease and eosinophilic esophagitis. So causes of esophageal obstruction, just like we listed: tumors, strictures, inflammatory conditions. Inflammation so much that it's actually leading to narrowing. Foreign body impaction. So sometimes you take up some things that the walls of the esophagus are not so large and flexible for it to pass, so it blocks. Then sometimes it's injury from long-term acid damage. That's what gastroesophageal reflux disease. As acid is coming from the stomach back into the esophagus, it's actually eroding and narrowing. You understand? So symptoms: there's difficulty swallowing, there's pain while you swallow, you feel like food is stuck in your throat or chest, right? Hoarseness of the voice, coughing and choking, regurgitation or vomiting, then unexplained weight loss. Your diagnosis is with endoscopy, barium swallow x-rays, CT scans, MRI scans. Alright, so what could be the possible treatments? If there's narrowing, you have to put balloons. Do you understand? If there's a growth of tissues, you can do surgeries. The endoscopy is also a surgery. You can use endoscopy for diagnosis and treatment. So you just excise the tissues and all of that. Basically just trying to put things that could actually increase the size back. Alright.